Hello, Mr. Smith.
Oh,
Can you tell me your name and date of birth?
Daniel Smith, July 6, 1996.
Okay. And can you tell me where you were born?
Mena, Arkansas.
Great. And what do you identify with gender-wise?
Male.
Okay. Are you married?
I am.
Okay. And what's your highest level of education that you've completed?
Bachelor's.
Okay. What do you do for a living?
I am a registered nurse.
All right. And health insurance, what type of health insurance do you have?
Blue Cross Blue Shield, I think it's state.
Great. Can you tell me what you're here for today?
I'm just here for to establish a primary care doctor.
Awesome. Okay, can you tell me a little bit about your past medical history? Do you have any illnesses as a child, such as measles, mumps, anything like that, injuries, hospitalizations?
No, the only time I've ever been to a hospital was I went to an ER one time for a broken wrist. That was reset a few weeks after it broke. And then about a year and a half ago, I had H. pylori.
Okay.
And I did the full course of antibiotics and things for that.
And you haven't had any issues since?
No, I've been on the original doctor that diagnosed me with H. pylori. I've been on 15 milligrams of Prevacid since then, though.
Okay. All right. Any surgical history that I should be aware of?
Just the arm reset when I was probably 12.
Okay. Sounds great. Are you up to date on your immunizations as far as you know?
Yes.
Okay. Do you have a tetanus within the last 10 years?
Yes.
Okay. Do you have any children?
No.
Okay. Any psychiatric history treated or history of?
No.
What about allergies? Any food, medications, latex?
No.
All right. Now, for current medications, I know you said you were on a Prevacid.
Prevacid and then a 25 milligram of sertraline. And sometimes in like the spring and summer, I'll do Flonase.
Okay. And can you remind me the dosage of the Prevacid?
15 milligrams once a day.
Okay. When was your last physical?
Probably 4 to 6 years ago.
Okay. When's the last time have you had any blood work done?
No.
Okay. And your last dental exam? Within the last 6 months?
No, probably 8 months or so.
Okay. All right. The next part is going to be about your family history.
Okay.
We're going to start with your parents. Are there any health issues or conditions that they have?
No.
Okay. What about your mother's side grandparents?
Grandmother has had breast cancer.
Okay. And your grandfather on your mom's side?
Nothing.
Okay. Let's move on to your paternal side grandparents.
Grandfather has had a few strokes
Okay.
and type 2 diabetes. Grandmother has had nothing.
All right. Are both of your mother and father still living?
Yes.
Do you have any brothers or sisters?
One brother, one sister.
And are they both still living?
Yes.
Any health issues with them?
No.
Okay. All right. We're going to move on to lifestyle patterns. So, can you tell me about your spiritual religion?
Christian.
And what is your perception of health? Obviously, you have a perception of health because you are setting up a primary care, so thank you for that.
Perception of health. Able to complete, all of the things I would like to do physically and mentally.
Okay. Great. Have you had any appetite changes? Are you happy with your weight?
No appetite changes. Yes, I'm happy with my weight.
Okay. Do you have any intolerances to any food, like milk or cheese, dairy, things like that?
No.
And do you feel like you intake the adequate amount of fluid every day?
Yes.
What do you primarily drink?
Water.
Okay. Elimination patterns, bowels are fine, everything is working?
Yes.
Okay. No issues with your bladder, any incontinence?
No.
Okay, living, do you live in the city? Do you live out in the country?
I live in Oklahoma City right now.
Okay, in the city. Any known environmental issues in the area?
No, not that I know of.
Occupational health, are you exposed to anything directly that you're aware of at work?
No.
Functional assessment, I know you said that you do everything that you're able to do and want to do functional wise. And I know you said you were married, so how does your role work in your family?
Head of the household.
Okay.
Yes, physical.
Mm-hmm. So if you were to be ill, would that affect your family?
Currently, at the position I'm in with work, no, we have paid time off for sickness.
Okay. Do you have any issues with any of your senses recently? I know you said you had some allergies.
Yeah, I mean, I have the occasional seasonal allergies that cause some, smelling loss, but once they clear up or go away during the day, they're
Okay.
fine.
No issues with your memory or
No.
anything like that, speech? What would you say you get to sleep, the amount of hours at night?
7 to 9.
Okay. And do you feel rested when you wake up in the morning?
Yes.
Okay. Do you take any naps during the day?
No.
Great. And how many pillows do you sleep with at night?
2.
Do you frequently feel the need to use a sleep aid?
No.
Okay, Mr. Smith, can you tell me how many times you exercise a week?
1 to 2.
Okay. Would that just be moderate or?
Moderate.
Tell me about your hobbies. What kind of hobbies do you have?
Exercising, video games, television, cooking. That's about it.
Okay, do you smoke at all?
Nope.
Do any drugs?
Nope.
Okay. Do you drink at all?
Yes, 1 to 2 drinks a week probably.
Okay. What kind of alcohol is that?
Almost always like a shot of rum with Coke.
Okay. All right. Do you feel safe at home?
Yes.
Okay. Have you had any major life changes in the last 2 years?
No, not really.
Okay, so how would you describe your stress level as a nurse right now?
Mild to moderate.
Okay. And the sertraline that you're taking, is that for stress?
Yeah, that's just a doctor when I was in nursing school that worked on the campus prescribed it just for generalized anxiety.
Okay. All right. Are you sexually active?
Yes.
Okay. Anything changed with that?
Mm-mm.
All right. Moving on. Okay. Any weakness, fatigue, or fever recently?
I had a fever about a week ago. Or
Okay.
maybe, yeah, a week or two ago.
And how long did that last?
Just one day.
Okay. And you went back to feeling fine after that?
Hmm?
Okay. Any noticing of your skin, rash, lumps, sores?
No, I do have like some, I don't know if it's been like determined that that's what it is, but I do have some like eczema.
Okay, you experience some dryness. Is that just in the winter or is that all the time?
A little bit of both, mainly in the winter though.
All right. Do you have any headaches, head injuries, dizziness,
No.
any issue with vertigo?
Mm.
Do you wear glasses at all?
Mm.
Okay. When was your last eye exam?
4 to 6 years ago, probably.
Okay. Do you have any blurred vision, redness, anything like that? Okay. Do you ever hear a ringing in your ears? Have you noticed any hearing decrease, increase, anything like that? Ear infections,
No.
hearing
no,
loss?
No.
No hearing aid use?
Mm-mm.
Okay. Moving on to colds. Have you had a cold in the last 6 months?
Yes.
Okay, when was that?
I had one at the start of January, and that was pretty much just some congestion, light fever, and then I had one towards the end of January, and that one was seemed a little more like it was sinuses.
Okay.
And they both lasted about 3 days.
Any sinus pain recurring after that?
No.
Okay. And I know you said you had seasonal allergies. I'll write that down for your chart. Any nasal obstruction? Are you able to breathe today and haven't had any issues? Okay. All right. Do you experience bleeding when you brush your teeth and your gums?
No.
Okay. Any toothaches, lesions in your mouth?
No.
You said your last dental exam was about 8 months ago. Any sore throat?
No.
No? Have you had your tonsils removed?
No.
No? Okay. Okay. Any neck stiffness or limitation of movement?
No.
No lumps or enlarged tender nodes?
Mm-mm.
Okay. No swelling in the armpits or in that region?
No.
Have you had a cough recently?
No.
Okay. When was your last chest x-ray that you can remember?
Probably never.
Okay. And your last TB skin test, since you are a nurse?
TB skin test. I think the last one I would have had would have been in, they didn't do a TB skin test, but they did do a blood draw for it a year ago when I started at the current hospital on that.
Okay, and that was negative?
Yes.
Great. Have you ever had any come back positive?
No.
Okay. Do you notice any chest pain or palpitations?
No.
No dyspnea, hard to breathe? Do you have hypertension?
Not diagnosed hypertension. Every now and then I'll do like a little wrist thing at home. And it'll come back like marginally high, like 130 over 80s or 90s.
Okay. All right. Appetite's all right?
Mm-hmm.
No change in your appetite, nausea, any heartburn?
Sometimes, I think the Prevacid controls it. Sometimes I'll have to take a Tums or two if I eat something that's like pizza or something like that.
Okay. All right. And bowels, you said were okay. No hemorrhoids, constipation, diarrhea.
Mm-hmm.
Okay. You do not experience any frequency or urgency
No.
when urinating?
Mhm.
Okay. No burning, stinging, anything like that?
No.
Okay. Any exposure to HIV?
No.
When was your last testicular exam?
Probably 8 years ago for
Okay.
basketball.
And that was
Just a
from
physical.
Okay. No issues?
No.
From there on? Okay. Any issues vascular wise? Do you have cold feet, cold hands, any tingling, discoloration, history of blood clots?
No.
Okay, and muscles and joints, they all feel okay when you're exercising? No cramps, stiffness?
No.
Okay. Moving on. Any syncope or passing out?
No.
No. Weakness, paralysis, involuntary movements, you're able to remember things okay?
Yes.
No history of mental disorders or anything like that?
No.
Just the stroke history with your grandfather?
Mm-hmm.
Okay. No history of anemia?
No.
Do you bleed or bruise easily?
No.
Have you ever had a blood transaction before?
No.
Okay. No exposure to toxic agents or radiation at work?
Not that's not controlled. I mean, if we do X-rays, we wear lead.
Okay. Any heat or cold intolerance that you're aware of?
No.
Do you have any excessive sweating?
No.
History of diabetes?
No.
Okay. Any thyroid issues that you think of?
No.
Any hormone replacements?
No.
Have you noticed any changes in hair distribution?
No.
Okay. Currently, do you have any depression, memory changes, any attempts of hurting yourself?
No.
Any nervousness or anxiety that's not controlled with your medication?
No.
Okay. All right, well, I'll put this in and thank you for your visit.
Thank you.